Something else that is often asked about, I think, on certainly from what we've seen on the forums and with the Joint School app and so on, is around squeaky hips, or like hips making a noise or clicking afterwards.
Mm-hmm. Yeah. Okay. So that's something which is actually quite specific to a specific type of hip replacement. So it's pretty uncommon to get noises from a hip if it's not a ceramic on ceramic hip. So by ceramic on ceramic, what we mean is that the ball is made of ceramic and the liner in the socket is also made of ceramic. So the two things that are rubbing against each other are both ceramic. Okay. Now, sometimes if the position is slightly abnormal, then basically the ball rubs on the edge of the socket rather than being nicely covered by the socket. And that's something which can sometimes lead to a bit of a squeak. Okay. Obviously, squeaking is a very variable, so it can be something that might occur really infrequently. It might be something that occurs maybe when a patient just leans down to tie the shoelaces in the morning, but then after that it doesn't happen again. Or it might be so severe that every time they move and every time they walk, it constantly squeaks. And I'm sure many people have seen, on the internet, there are videos of these horrendous, squeaking hips. And obviously, the worse it is, the more likely there's a serious problem with the hip. So if it's just a minor, really not inconvenient kind of noise, and the X-rays all look fine, then that's probably not something to worry too much about. The chance of it happening, if there's a polyethylene liner, which is probably the more common situation, the hips just don't squeak in that situation.
Right. Okay.
If you do have a ceramic on ceramic hip, you might say, well, what's the chance of it making noises? And it can be higher than you might expect. We actually did a study which we published where we sent questionnaires to patients who'd had that type of hip, and actually found that probably about 20% of people had experienced some kind of noises from their hip. Right. And interesting, out of that group of about, I can't quite remember the exact numbers, but around about 300 patients, we hadn't had to revise any of the hips for squeaking. So they're all relatively minor. But there is that sort of background level of intermittently, that they have these noises. Right,
but I guess within that group there would have been potentially a bit of a range as well in terms of how severe that squeak or the noise was.
Yeah, that's right. Yeah. Although we didn't really have anybody that had any kind of severe noises on normal walking. It's all just kind of intermittent.
Okay. Yeah. Okay. And you mentioned that a squeak or a noise could be related to the positioning of the implant, or malalignment, problems with the position, with the implant not quite being sort of in the optimal position. What other issues could that cause?
So
beyond squeaking and noise and things like that.
Right. Okay. Well, maybe perhaps I'll just sort of another thing actually, maybe before we get on sort of past that squeaking issue. Yeah. So I think one of the important issues around squeaking is that if you've had a really good hip and then suddenly it starts squeaking quite a lot.
Oh yeah.
That's a really important kind of flag, I suppose. A new symptom, you want to get that checked out, because there is a chance that a sudden new squeak might be related to some damage to the ceramic. So like a chip or even a fracture, can then really cause quite a lot of noise within the hip joint. Right. So if you suddenly have that, then that's something that you'd want to get checked out. But most people would, because if you've had a hip replacement, it's doing fine, and suddenly it starts making noises, you're going to go, crikey, I need to go and see my GP or my doctor.